Welcome to yet another Health Package Field Program Community Health. With me, your regular host, Hasia Ali. With me today in the studio is Dr. Yusuf Habib from the Department of Obstetric and Gynecology, Ahmadu Bello University Teaching Hospital, Shika, Zaria. Dr. Habib is a resident doctor also from the Teaching Hospital, Zaria. We say a very warm welcome to you, Dr. Habib.
Thank you very much.
You're welcome. Dr. Habib, today we'll be discussing about the topic Lassa fever. But particularly, we're talking about Lassa fever in pregnancy. So, Dr. Habib, why are we talking about Lassa fever in pregnancy first?
Okay, good afternoon, listeners. Thank you once more. Over the years, Lassa fever is a dreadful disease condition. It's a viral hemorrhagic fever that affects healthcare workers and non-healthcare workers.
Okay.
We've noticed that the portal of entry most of the time is patients who are being operated on. Maybe patients who are pregnant and require some form of intervention, maybe surgically, cesarean section, or who come in for delivery.
Okay.
We've noticed that over the years, the first cases that are usually reported during the peak period when Lassa fever is top-notch, pregnant women are usually the first group of patients that present to the hospital with such kind of disease.
Okay, so now we talked about that. Let's see what Lassa fever is, basically.
Well, Lassa fever is a viral infection.
Okay.
Generally, they refer to them as a group of infection that we term as viral hemorrhagic fever.
Okay.
It is such that it's a disease that affects the West African sub-region and comes with, a lot of dreadful complications and, clinical presentations, which we are going to discuss in the course of this.
Okay, so let's see. What are the risk factors of Lassa fever?
Well, if I'm to reframe your question, I would want to look at it in a broader essence, which is talking about the epidemiology of Lassa fever. Okay. By epidemiology, we mean the distribution of the disease, the determinant, the deterrent, and the so-called risk factor you asked about. Okay. So, epidemiologically speaking, Lassa fever, like we initially highlighted, is a disease of the West African sub-region, Nigeria inclusive, Sierra Leone, Guinea, and other West African countries. Okay. Annually, they record about 100 to 300,000 cases, new cases, every year.
Every year?
Yeah, wow. Every year we have up to that. And so far it has been reported that about 5,000 deaths occur annually. Yes, from Lassa fever. So it's a disease of public health importance. It's endemic in the African sub-region. And occasionally, yearly, there are epidemics. That's when the transmission is beyond the normal for that particular year. Yeah. So the risk factors generally are such that when you have the mastomes, because we're going to talk about the mastomes natalensis or the multimammate rat, which is responsible for its transmission. It starts, the peak period is normally during the late rainy season towards the dry season, because that's when you have bush burning happening. So those rats are usually driven out from their crevices and their niche or habitats, and they come into the environment. And in the West African sub-region, food is being processed and left open on the road. So when there's bush burning, these rats come in contact with those food.
There's food on the road.
And human being gets to eat those food by virtue. Those rats can excrete maybe their feces, their excreta, or urinate on those food. So when human beings ingest those food, they come down with, because the rats are the ones that contain the virus. That's the mastomes are,
So it doesn't have to be a direct contact. Once it comes in contact with the food, that is it.
Yes. Or if an individual ingests that rat, because we also know that in the West African sub-region,
some people do eat rats.
Yes, some people ingest rat as a source of food. So these are risk factors, actually. Number one, to be very specific now, is number one, living in the West African sub-region, because that's where you have those type of rats and the virus in them.
I was going to ask, why in West Africa?
Yeah, that's just, there are specific type of organisms or specific type of animals that are found in specific type
areas.
of, yes. So it has been documented and found so far that the mastomes rat, that's the multimammate rat, is particularly distributed around the West African sub-region. So one, living in the West African sub-region is an important risk factor. However, there may be imported cases. You may not be in the West African sub-region, but of course, because we intermingle, we travel, people can move from West African sub-region to other region, and by so doing, they move those diseases to that area. So imported cases, however, West African sub-region is the most important. Then number two, ingestion of those rats as meal or meat is another risk factor to contract the disease. Then ingestion of food substances that have been, contaminated by these rats, like, the gari, the common cassava, it's usually dried on the road. So when that happens, those rats can go, by trying to feed from them, they also urinate and excrete and
pack it together in one place also.
That's and other food, not necessarily gari now. So these are just some of the risk factors, or the epidemiology of the disease now. Speaking.
Okay, you said something about bush burning, and then the Lassa fever is usually high during the late rainy season. But why is that so? Is it because there's more food for them to eat during the rainy season, or the burning from the bush send them out to look for food elsewhere? Yeah,
the latter is actually the case, not the former. I don't know whether you get what I'm trying to say. Now, the case of bush burning is usually what happens, because these rats, their niches or their habitats is the bush.
Okay.
So as rainy season is, like we said, late rainy season is going out, the bushes start becoming dried, and people in those environments want to burn those bushes to have some, good atmosphere and all of that. So by so doing, the bush burning sends those rats away from their house, because the heat, they can't contain that, so they run. And probably if our houses are not well gated, are not well netted, are not well covered, they come in contact into the houses and destroy our food items by so doing, releasing the virus.
So now, after all you've said about the epidemiology, now let's look at the causative agents of this Lassa fever.
Okay, in the course of our conversation, we'll mention that, but it's still important to resound that as you've asked. The causative agent is different from the reservoir. The causative agent of Lassa fever is Lassa virus, and it was first discovered in Nigeria, surprisingly, among the West African country. Lassa fever was discovered in Borno State, Lassa local government of Borno State, and that's how the virus actually came into place. So the causative agent is Lassa virus, and the reservoir, like we initially said, is the Mastomys natalensis. There are other species. That's the multimamate rats. The way to identify them is, I'm not saying you should go and touch them anyway. But when you put them over and you see they have plenty breasts, yes, along the abdomen. Okay. So that's how to identify those type of rats.
So having said that, what are the modes of transmission?
Well, the modes of transmission basically can be divided into two. There can be primary mode of transmission and the secondary mode of transmission. The primary mode of transmission is it accounts for about 80 to 90% of the transmission of Lassa viral disease, and this practically just entails people who ingest the rats.
Okay.
Yes, that's Mastomys, rat. That's primarily they get the virus directly from the rat, or people who eat food that have been contaminated by the urine or feces from that rat. Then secondary means accounts for the remaining percentage, and however that comes from individuals who are infected. That's human-to-human transmission now.
Okay.
A patient who is infected, brought to the hospital, doctors, nurses, other healthcare workers, yes, are at risk of contracting the disease from that patient by taking maybe body fluids, the urine of the patient, blood and all of that. That's another, means. That's a secondary means of transmission. Okay. So when the patient is also in the hospital and suspicion or diagnosis of that disease has not been made, there's also called nosocomial transmission, nosocomial infection. The patient can transmit that disease to other patients in the hospital.
Okay. That's patient-to-patient transmission.
Yes, patient-to-patient, transmission can.
That's by sharing things. When patients actually do that,
yes.
Let me use your plate and
okay. Yes, so that can actually happen too.
Okay.
So those are basically the means of transmission.
Okay. So what are the signs and symptoms for you to know that one is down with Lassa fever?
Well, to shock you, more than 80% of times, patients with Lassa fever may be asymptomatic, meaning they may not even have any symptoms.
Okay.
Yes. The incubation period, actually, that's the time from which one has been exposed to the virus to the time of manifestation of symptoms, has been documented as low as 5 days, and it can be as high as 3 weeks. That's 21 days.
Okay.
So 5 to, some literature will document 7 to 21 days. So during those periods, an individual, depending on one's immune system, and as we're going to look in the course of our presentation, pregnancy, is associated with some form of immunosuppression. So depending on how immune an individual is, he may mount immunity to the virus and clear it without even
medication.
Yes, discovering that that individual is, infected by Lassa virus. So, however, the remaining 20% or so that may present with symptoms, one constant thing that you find in those patients is that they have fever.
Okay.
Yes, they must be fever.
So that's why it's Lassa fever.
Exactly.
Okay.
So aside that, they can also come with body weakness, body pain, chest pain, cough, abdominal pain, vomiting, passing loose watery stools.
Wow. More like a diarrhea.
Exactly.
Okay.
Exactly. So these are. Then, in terms of complications too, that may also result, can also, because they could present with complications. They can come with deafness,
Wow.
Yes. But sometimes it may be reversible in about 50% of patients. That's the deafness now. So these are some of the presentations that patients could come with. So that's the symptoms now, what they come to tell you in the hospital. However, when you as a doctor, after presenting, when you examine them, the signs now is what you discover in the patients. But the fact that we've already said they are febrile, when you use your thermometer to measure, their temperature will be high. That's a sign. They may look anxious, they may look worried, they may be dehydrated because they've been vomiting, they've been stooling.
But most of these symptoms are symptoms that people with cholera also come down with.
Exactly.
So how do you differentiate this particular one?
Excellent question. Now, in diagnosis of Lassa fever, one must maintain a high level of suspicion, high index of suspicion.
Okay.
That will take us to what we medically refer to as differential diagnosis, meaning that if it's not this condition, what can it be? So there are a number of tropical diseases. When I say tropical diseases, cholera is one of them, that mimic Lassa fever.
The symptoms
of Lassa fever. However, one thing that must be there for Lassa is, like I initially said, there must be fever. So malaria fever is also another possible close thing that we will quickly suspect when patients present with this kind of symptom. Typhoid fever, then even other viral hemorrhagic fever. We have Ebola. There are different...
A more critical one than Lassa.
Yes, than Lassa, with a very higher case fatality, rate, as it were. So one must maintain a very high index of suspicion. So what makes one maintain a very high index of suspicion? Remember, we said it's endemic in the West African sub-region. So especially when an individual has been treated with antibiotics. Antibiotics are supposed to take care of bacteria.
Bacterials.
Yes. Then parasites are the ones that are actually responsible for causation of malaria fever. That's Plasmodium, carried by female Anopheles mosquito. So when you treat malaria, you take antibiotics, and you're still not getting better. The index of suspicion should actually be high for possibility of a viral hemorrhagic fever, which, if it's within the late rainy season to the early dry season, then suspicion,
yes. One place to look at.
Exactly. So that's how to, look at.
Well, having said so much, especially where we are in an area where people do self-medicate. You find people saying, okay, it's just fever, and then they go to the pharmacy and then pick drugs. What do you say about those who pick drugs and eventually it's actually Lassa fever? What do you think will happen to them?
Okay, the gold standard in the management of Lassa fever is early presentation.
Okay.
And we're going to look at this when we come to the preventive aspect of Lassa fever.
Okay.
It is important to note at this point in time that no matter how trivial you feel your ailment is, as much as possible, even if it is virtually, speak to a doctor before you commence any medication. So at this point in time, it's very important to mention that self-medication is dangerous because you may not be doing yourself harm alone. You may also be doing your relatives and neighbors harm because it may not be what you're thinking of, and it may be something even more dreadful than what you're thinking.
All right, having said that, how do you make the diagnosis and what are the treatment modalities for Lassa fever?
Diagnosis of Lassa fever, like we initially highlighted, requires a high index of suspicion. there are a number of diseases that can mimic Lassa fever, which we've highlighted, and we also talked about how to differentiate this and, from that, and the most constant feature in Lassa fever. So diagnosis generally comes with considering the patient presentation. That's history. The patient will come and tell you what you find on examination and certain investigation you do. Now, it is particularly challenging to do investigation for diagnosis of Lassa fever. It's not just like you want to test for malaria. You can walk into any lab. You can even buy the test kits and even do for yourself. Labs that are designated for diagnosis or making tests for Lassa fever are highly classified laboratories, and they are just
the way the one for COVID-19 is.
if not now that we had a lot of places that it could be done. Okay. In the initial days of COVID-19, it used to be take sample, then take to the particular labs. Exactly. So for Lassa fever, we've not gotten to that level, and that's making the diagnosis actually more challenging. Okay. So specifically speaking now, when an individual has a particular infestation or infection, for Lassa fever is an infection now caused by that virus, the viral material, because the viruses contain certain materials, can be released into the body, and the body sees it as a foreign substance within itself. That's the human body now. So those things, we call them antigen.
Okay.
So we could do antigen detection tests. There are certain tests that can be done to detect the antigen of that particular virus. That's the Lassa virus now. That's one way that it can be used, to diagnose Lassa fever. On the contrary note, when this antigen enters the body tries, the immune system of the body tries to produce the soldiers now that fight the immune, that's the white blood cells, they produce certain antibodies to fight against this antigen. So we could also detect these antibodies in the blood. Okay. So we could do an antibody test, what we sometimes refer to as the enzyme-linked immunosorbent assay. That's we take blood. I'm trying to put it as simple as possible. That's antibody, antigen from the virus, then antibody, what the body produces. So we could test any of these two. Okay. However, we could even do a viral culture. The virus can be cultured. Okay. Yes, the virus can be cultured. Then lastly, the genetic makeup or material of the virus may also be, isolated through what we refer to as the reverse transcriptase polymerase chain reaction. Okay. So that could be done. So these are some of the panels that could be used in.
So the test is usually the blood from the suspected patients.
Yes.
That would be taken to the lab.
Yes, or body fluids.
Body fluids.
Yes, body fluids may be taken. So the treatment now is largely supportive. That's if the patient is having fever, you give medications that will bring down the fever, antipyretics, paracetamol, for instance. If there are pain, you give pain relief. If the patient is vomiting, you give something to stop the vomiting. Antiemetics. If the patient is dehydrated, you give the patient fluid. Now, if the patient presents early, like we said, presentation can span between 5 to 21 days, as it were. If the patient presents early, studies have shown that the patient can benefit from treatment, because there's a drug treatment actually for the Lassa virus. It's an antiviral drug that can be given to patient, and patients who present early and receive these drugs, they do well. Eventually, they recover from the said disease.
Okay. All right. So now let's come back to our main topic, where it's Lassa fever in pregnancy. So, what are the effects of Lassa fever on pregnant women? Okay,
that's a very excellent question. Pregnancy generally, like we said initially, but I'll reiterate again, is an immunosuppressive state. When I say immunosuppressive, meaning it brings down the immunity of the woman in question. And we can generally divide pregnancy into 3 phases, or 3 trimesters. The first 3 months, second 3 months, and the last 3 months. That's first trimester, second trimester, and the last trimester. Now, any infection generally, or infestation as it were, have effects on pregnancy, either on the woman or the baby she's carrying, or both. Now, in the first trimester, some of the problems that Lassa fever can, the effect it can have on pregnancy may range from causation of bleeding, because even in the symptom complex of Lassa, there's also bleeding. And this bleeding, especially if it's coming from the genital tract, that's vaginal bleeding now, can be a form of miscarriage. Yes, so the Lassa, because it can affect the placenta, and when that happens, the pregnancy becomes threatened. So miscarriage may be a threatened miscarriage, maybe an inevitable miscarriage, or even an incomplete, or even complete, as it were. So it can lead to miscarriage. If there's bleeding, anemia can also result. So it can lead to anemia in pregnancy.
Okay.
Yes, when the woman bleeds, it can lead to anemia in pregnancy. She can have dehydration from the vomiting and all of that in pregnancy as well. Now, because in the presentation of Lassa fever, there are inflammatory substances that the body release.
Okay.
So as pregnancy advances, especially in the second trimester, it can cause some form of preterm contractions. That's the woman will start having contractions when it's not even time,
for
her delivery.
Wow.
So it can predispose her to preterm contraction, and if that happens, there could even be preterm labor, and she can also, deliver a preterm baby.
Wow.
You understand? These are even milder presentation.
Okay.
Now, the baby can even die inside the
mother
without her knowing. So there can be what we refer to as intrauterine fetal demise or death from this Lassa virus. So the effect on this pregnancy now. Now, as the pregnancy advances, the morbidity and as well mortality of Lassa fever on pregnancy also increases.
Okay.
The effect is more even in the third trimester, because at that stage, the woman can even die.
Whoa.
Yes. Now, the fatality rate for Lassa fever in third trimester has been documented to be in the range of over 30%. The chances that the woman can die in the third trimester now. Same as for the fetus, that's the baby now, it has been documented in the range of 85%. That's the death of the baby from a pregnant woman who is infected with Lassa fever.
Okay.
So,
around 85%.
yes,
Okay.
so she could also have antepartum hemorrhage. In the early trimester, that's first trimester, we said it may be miscarriages. That's a form of bleed. So she could present with antepartum hemorrhages in form of placental separation. That's abruption now, and that has a dreadful effect on the baby. That's the placenta that is supposed to feed the baby and separates from its attachments. So the baby becomes left without anything. So, that baby can also die from that. The dreadful thing in the third trimester, like we said, which no one wants to hear, is the demise of the woman. So these are just to mention but a few of the problems or the effects that Lassa fever could have, in pregnancy.
Okay, having said the effects of Lassa fever on pregnancy, now let's look at the effects of pregnancy on Lassa fever.
Well, there are no much documented effects of pregnancy on Lassa fever, other than the fact that the severity of Lassa is actually more in a woman who is pregnant. For obvious reasons, we highlighted that it's an immunosuppressive state, and that would allow the virus to flourish faster because the immune system has been dampened. It will not be able to fight as it's supposed. So the progression of the disease is faster in pregnancy. Then, remember we said in the treatment of Lassa, there's a drug that has been documented to treat the disease, especially if it is used in the early phase. That drug is contraindicated in pregnancy. It's not supposed to be used for a pregnant woman. Because of the peculiarity. It may cause damages to the baby. So not just the disease itself, the drug now, will affect. So these are some of the effects that pregnancy will have in the management of, a patient with, Lassa fever.
Okay.
So use of the drug now. Aside the progression, it hastens the progression of the disease because they come with more severe disease. So when you see a woman and you think she has Lassa fever, just be rest assured that the progression comes with mostly severe presentation. Then drug treatment becomes hampered.
Okay. So having looked at the effects of Lassa fever on pregnancy and the effects of pregnancy on Lassa fever, are there preventive measures that we can take? Yeah,
prevention is better than cure, as it is colloquially said. There are levels to prevention. There's a primordial level. Some people may want to look at it at 3 levels, but I would prefer to look at it at 4 levels. There's primordial prevention, there's primary prevention, there's secondary, and as well tertiary prevention. For primordial, it just does what it talks about there. It just entails the government making regulation or policies that at so time nobody should go and burn bush.
Okay.
Yes, that's the dry season. No, people should not burn bush. The people should ensure that crevices or their houses, netted, gates well gated, and stuff like that. It's a government policy. Ensure that the transmission of the disease is hampered.
Minimal.
Yes. Then that's basically what happens at the primordial level. For primary prevention, the 2 subheadings under that is just general health promotion and specific protection.
Okay.
General health promotion in the sense that people should be they should maintain optimal level of hygiene. Food should not be dried open. Food should be covered with in a rubber and,
airtightly.
Exactly. It's not such that those rats, even if they are available,
could penetrate
into the food and maybe excrete or urinate, as it were. Then also discourage people as much as possible. But I don't know, because it's more like a traditional something for people to feed on, rats. So as much as possible, discourage people from ingestion or alternative source of meats other than the rats. So it's just a general health talk, hygiene, environmental sanitation, anything that will attract those rats.
Stay away from
Stay away from
away from the house and the offices.
Exactly.
Because there are some offices that have rats.
Certainly, most definitely. So then the specific protection, which is also a component of the primary prevention, is not applicable in the case of Lassa fever. And what that entails is just vaccines. Upfront, you stimulate the individual's immune system such that even if the virus enters, the immune system has been primed. Yes.
Okay.
But currently, as we are speaking, maybe tomorrow or maybe in the next 5 minutes, but as at now, there's no vaccine, available for protection.
There should have been a vaccine for Lassa fever longer than now, because coronavirus just came recently, and we already have so many vaccines for that.
Yeah, well, a lot of scientists are still,
working on it.
This is more of an African
disease.
Yes,
okay,
than
so it
if
doesn't affect the world.
If it's a pandemic, if it affects the whole world, even though it affects the whole, remember we talked about imported cases. But it doesn't have a lot of public health importance to the Western world as compared to Africa. So probably that's why, but I'm sure there are other challenges associated with development of the vaccine. Then secondary prevention entails early diagnosis and treatment. So quickly when the index of suspicion is high, you quickly triage the patient and take samples and send for investigation. Then, of course, quickly administer medication. Then for tertiary, it just entails rehabilitation of the patient and reintegration back to the society. Treatment of complications as well in such patients. The then governor of Nasarawa State had Lassa fever. He recovered and eventually had complications, which is deafness. And I think up to now he's still using a hearing aid.
Yes.
Also.
Okay, now finally, before we go, let's quickly you could help us could tell our listeners to be careful about.
Okay, listeners at home, students and healthcare workers, non-healthcare workers, it is important to know that we are at the period where Lassa fever disease is on the rise. It's no longer epidemic now. It's no longer endemic now. It's an epidemic now, meaning the spread. People have died so far. Doctors have died so far. WHO doctors from Benue State have been reported to have died from this said disease. So I would advise that students, as they are resuming back to school, especially now, they make sure that they cover their foods properly. That's one. Secondly, that's looking at prevention now. Secondly, even if they start feeling funny, that's having symptoms, they should not just assume, like we initially highlight. They should present to healthcare, the sick bay now. That's the
University
Health Service Center, to be reviewed by at least a doctor who sees them and maybe, tell them that this is what their problem is and give them medication other than self-medicating. So these are just some of the few, take-home I will give. Also, lastly, to know that it's a disease that can kill. So the earlier one presents, the better.
All right. Thank you so much, Dr. Habib. You've highlighted our listeners on Lassa fever, especially in pregnancy. So listeners, we've been talking to Dr. Yusuf Habib from Obstetric and Gynecology Department, Ahmadu Bello University Teaching Hospital. Dr. Habib is a resident doctor from the same teaching hospital. Dr. Habib, we say thank you so much for honoring our invitation. And we are looking forward to having you some other time for you to discuss more on other issues.
It's my pleasure. I'll always be here if I'm called upon.
Thank you very much. Listeners, it's been Community Health. Join us same time, same station next week for yet another interesting episode of the program. On behalf of the staff and management of ABU FM, I am Hasia Ali saying thanks for listening.